Welcome to 10-Minute Health Tech, the AI-powered podcast, where we dive into healthcare technologies and companies so you don't have to. I'm Anthony.
And I'm Julia.
Today, we're taking a deep dive into Homeward, a company aiming to transform healthcare access, particularly for those in rural communities.
That's right. And one thing that might surprise you about Homeward is that they aren't trying to replace your existing doctors. They actually work with them.
Really? So how does that work?
Homeward sees itself as an extension of your current care team. They collaborate with your existing physicians and specialists to ensure everyone's on the same page regarding your health needs.
That's interesting, because you often hear about new healthcare companies trying to disrupt the existing system. This sounds like a more collaborative approach.
Exactly. And they also work within your current insurance plans, including Medicare and Medicare Advantage. This can be a huge benefit for people in rural areas who might already be facing limited options for healthcare providers.
That makes sense. It removes a potential barrier to accessing their services.
Yeah.
So how are they specifically addressing the challenges of rural healthcare?
One of the key ways Homeward is tackling this is through localized care teams. They understand that rural communities often have unique needs and challenges, so they build teams that are familiar with the local area and its resources.
So it's not just a one-size-fits-all approach. They're really tailoring their services to each community.
Precisely. And that's where their care navigators come in. Think of them as your personal healthcare guides. They help you navigate the often complex world of healthcare, especially in rural settings.
I'm intrigued. What kinds of things do these care navigators actually do?
Well, they wear a lot of hats. For starters, they help you understand your insurance benefits and what's covered under your plan. They can also assist in finding in-network doctors and connecting you with local support services.
What kind of support services are we talking about?
Things like transportation to appointments, meal services, or caregiver support. They even help with medication management, obtaining necessary medical equipment, and scheduling those all-important doctor appointments.
It sounds like they're trying to cover every aspect of a patient's healthcare journey. Do they also provide support during unexpected health events?
Absolutely. If you experience an unexpected health issue, your care navigator can be a valuable resource helping you get the care you need quickly and efficiently.
This is all starting to paint a picture of a truly comprehensive approach to healthcare, especially for people in rural areas who might otherwise struggle to access these types of services.
That's exactly right. They aim to address not just the medical aspects of care, but also the social and logistical barriers that can often prevent people in rural communities from getting the health care they need. And it's not just about reacting to health problems as they arise. Homeward is also focused on preventive care. They want to help people stay healthy in the first place.
That's so important. What kinds of preventive care services do they offer?
Well, for example, they encourage regular checkups, annual wellness visits, and appropriate cancer screenings. These are crucial for catching potential problems early on when they're often more treatable.
That makes a lot of sense. Early detection can make a world of difference. Now, you mentioned earlier that Homeward works with the patient's existing insurance plans. Can you elaborate on that?
Absolutely. Homeward is in network for traditional Medicare and most Medicare Advantage plans. So if you're already on Medicare, there's a good chance your existing coverage will apply to Homeward's services.
That's great news for people on Medicare. It really simplifies things for them. But what about those who aren't on Medicare?
Well, Homeward's care navigators can work with you to understand your specific insurance plan and benefits. Regardless of whether it's Medicare or a private insurance plan, they can help you figure out what's covered and what your out-of-pocket costs might be.
So it sounds like even if you're not sure about your coverage, it's worth reaching out to Homeward to see what they can do for you.
Exactly. They're committed to making healthcare accessible and easy to understand, and their care navigators are there to guide you every step of the way.
I'm curious to know more about the types of health conditions Homeward typically helps manage. Can you shed some light on that?
They address a wide range of conditions, really encompassing the spectrum of healthcare needs. For instance, they support individuals with chronic illnesses like diabetes, high blood pressure, high cholesterol, and heart disease.
Those are some of the most prevalent health concerns, especially as people age. What about other conditions?
They also provide care for respiratory conditions, such as COPD, which can be particularly challenging for people living in rural areas with limited access to specialists.
That's crucial. And what about mental health? We know that access to mental health care can be a significant issue, especially in rural communities.
You're absolutely right, and Homeward recognizes this. They have services dedicated to addressing mental health needs such as anxiety and depression, along with other mental health concerns.
It's impressive to see a company tackling such a diverse range of health issues, all while focusing on serving those in rural areas who often face greater barriers to care.
It's a testament to their commitment to holistic and equitable healthcare. They understand that good health encompasses physical, mental, and social well-being, and they strive to provide comprehensive support for all of these aspects.
I'd love to hear a real-life example of how Homeward has impacted someone's life. Do you have any stories you can share with us?
Yes, actually. There's a Homeward member named Leslie who shared her experience. She described Homeward as a blessing, saying, "You just know that they care. That's the best part."
Wow, that's powerful. It speaks volumes about the personal touch and genuine care that Homeward provides. It's one thing to talk about services, but hearing a real person's experience really drives home the impact they're making.
Absolutely. And Leslie's story highlights a key aspect of Homeward's approach. They go beyond just providing medical care. They truly focus on building relationships and supporting their members' overall well-being.
It sounds like they're changing the way people experience healthcare, making it more accessible, personalized, and compassionate.
That's a great way to put it. They're bridging gaps in care and empowering people to take control of their health, especially in areas where access to quality healthcare has traditionally been limited.
It's inspiring to see a company so dedicated to serving a population that often gets overlooked. Their commitment to improving the health and well-being of rural Americans is truly commendable. So what does this all mean for the future of rural healthcare? What kind of impact could Homeward have?
Homeward's model has the potential to be a game changer for rural healthcare. If we connect this to the bigger picture by bridging gaps in access, providing comprehensive care coordination, and addressing the unique challenges faced by rural communities, they are creating a blueprint for how healthcare can be delivered more effectively and equitably in these underserved areas.
It's really exciting to think about the possibilities. If their approach proves successful, it could inspire other organizations and policymakers to adopt similar models and expand access to quality care for even more people.
Exactly. It's a powerful example of how innovation and technology can be harnessed to create positive social impact and address healthcare disparities.
Well, it's clear that Homeward is doing some important work in the healthcare space. Their focus on rural communities, their collaborative approach, and their emphasis on patient support are all incredibly valuable. We've covered a lot of ground today. Before we wrap up, what's one key takeaway you think our listeners should keep in mind about Homeward?
I think the most important thing to remember is that Homeward is all about empowering patients, particularly those in rural areas, to take control of their health. They provide the tools, resources, and support needed to navigate the complexities of the healthcare system and achieve better health outcomes. It's about giving people the knowledge and confidence to be active participants in their own healthcare journey.
Well said. And for anyone listening who's intrigued by what they've heard today and wants to learn more about Homeward, what would you suggest they do?
It's easy to connect with them. You can simply call Homeward directly. They have a dedicated phone line where you can request an appointment or get more information.
That's good to know. It sounds like they're really trying to make it as straightforward as possible for people to reach out and explore their options.
Absolutely. They understand that navigating the healthcare system can be confusing and overwhelming. Their goal is to simplify the process and make it less intimidating, particularly for those in rural areas who might be facing additional challenges.
It's refreshing to see a company so focused on patient-centered care and removing barriers to access. It feels like a real shift in the healthcare landscape.
I think you're right. Homeward's approach is truly innovative. They're demonstrating that it's possible to deliver high-quality, personalized healthcare to everyone, regardless of where they live.
It's exciting to think about the potential ripple effects this could have on the healthcare industry as a whole. If this model proves successful, it could pave the way for similar initiatives in other underserved communities, both rural and urban.
It's a powerful example of how we can leverage technology and a human-centered approach to create a more equitable and accessible healthcare system for all.
Well, on that note, it's time for us to wrap up another deep dive.
Thanks for spending 10 minutes with us, and be sure to look for more 10-Minute Health Tech podcasts.
Bye.